Hello all. In today's video, I'm going to discuss about dietary fiber in health and disease. Fiber became a household word back in 1970s when Dr. Dennis Burkitt, nicknamed the Fiber Man, and his colleagues made the fiber hypothesis. The hypothesis states that fiber can prevent certain diseases like heart attacks, high blood pressure, obesity, and diabetes. Some intestinal problems like constipation, gallstones, appendicitis, hemorrhoids, polyps, and colon cancer. What is dietary fiber? Dietary fiber is a part of plant material in the diet which is resistant to enzymatic digestion that includes cellulose, non-cellulosic polysaccharides such as hemicellulose, pectic substances, gums, mucilages, and a non-carbohydrate component, lignin. The diets rich in fiber, such as cereals, nuts, fruits, and vegetables, have a positive effect on health since their consumption has been related to decreased incidence of several diseases. Fiber is also referred as bulk or refuge. Fiber is an essential part of everyone's diet. While fiber does fall under the category of carbohydrate, it does not provide the same number of calories, nor is it processed the way that other sources of carbohydrate are. There are two types of fiber, and we need to eat both in our daily diets. They are soluble and insoluble fiber. Soluble fiber dissolves in water to form a gel-like substance. Sources of soluble fiber are oats, legumes, apples, bananas, berries, barley, some vegetable and cereal. Insoluble fiber increases the movement of material through the digestive tract and increases your stool bulk. Sources of insoluble fiber are whole grain foods, bran,s nuts, seeds, and skin of some fruits and vegetables. The various components of fiber, they include cellulose, hemicellulose, pectin, gums and mucilages, lignin, resistant starch, and non-digestible oligosaccharides. Now, what is cellulose? Cellulose is a polysaccharide comprising up to 10 to 1,000 closely packed glucose units arranged linearly, making cellulose very insoluble and resistant to digestion by human enzymes. Principal components of the cell wall of most plants forms about 25% of the fiber in grains and fruits and about a third in vegetables and nuts. Much of the fiber in cereal bran is cellulose. So these are the sources of cellulose. Now coming to hemicellulose. Hemicellulose are polysaccharides containing sugars other than glucose. They are associated with cellulose in cell walls and present in both water-soluble and insoluble forms. This hemicellulose they are found in fruits, vegetables, legumes, and nuts. The main dietary sources are cereal grains. Next is pectin. Pectin, they are polysaccharides comprising galactouronic acid and a variety of sugar. Soluble in water, that is, it is soluble in hot water and forms gels on cooling. Pectins are found in cell walls and intercellular tissues of fruits and vegetables. Fruit contains the most, but pectin also represents 15 to 20% of the fiber in vegetables, legumes, and nuts. Sugar beet and potato are also sources of pectin. Next is gum and mucilage. Gums are hydrocolloids derived from plant exudates. Mucilages are present in the cells of the outer layer of seeds of the plant family, for example, psyllium. Both are used as gelling agents, thickeners, stabilizers, and emulsifying agents. Now coming to the example, plant exudates, that is gum arabica and tragocant seeds. They contain these gums. And some seaweed extracts like agar, carrageenans, and alignates. They also contain gums. Mucilage, example for mucilage is psyllium. Coming to lignin, it is not a polysaccharide but chemically bound to hemicelluloses in plant cell walls. Foods with woody component, for example, celery, and the outer layer of cereal grains or rich in lignin. Now coming to resistant starch. Starch and starch degradation products that are not absorbed in the small intestine, they pass into the large intestine and they are fermented by the intestinal bacteria. Four classes have been identified: physically inaccessible starch, native starch granules, retrograded starch, and chemically modified starch. If coming to non-digestible oligosaccharides, the endeavors comprising 3 to 10 sugar units occur naturally in plant consumed as foods, mainly vegetables, cereals, and nuts. They can also be made chemically or enzymatically from mono or disaccharides or by enzyme hydrolysis of polysaccharides. So sources of non-digestible oligosaccharides, they include onions, chicory, and Jerusalem artichokes. So how much fiber is needed for a day? Like a decreased fiber consumption is associated to many metabolic diseases, non-communicable diseases. The Academy of Nutrition and Dietetics gives the following daily fiber recommendations for adults. That is 21 grams per day for women older than age 50. 25 grams per day for women age 50 or younger. 30 grams per day for men older than age 50. 38 grams per day for men aged 50 or younger. So these are the dietary recommendations, and we have to include these amount in our diet regularly. Coming to the role of fiber in health and disease. People who eat fiber-rich diets tend to have a reduced risk of certain cancers, coronary heart disease, and obesity. Fiber can help to reduce the energy density of foods owing to its bulking effect and can promote satiety. Although whole grain foods provide fiber, in addition, they supply micronutrients, essential fatty acids, and some protein, all of which contribute to good health. They also contain a wide range of other bioactive substances that may be in due course be shown to have important health benefits. Fiber for weight control. There is some evidence that bulking up could lead to slimming down. In a recent study of more than 1,700 overweight and obese men and women, those with highest fiber intake had a greatest weight loss over 24 months. One of the reasons that fiber may have an impact on body weight is its ability to slow the movement of food through the intestine. The gel-like substance that soluble fibers form when they dissolve in water causes things to swell and move slower in the intestine. This increasing time that food stays in intestine has been shown to reduce hunger feelings and overall food intake. It has also been shown to decrease the number of calories that are actually absorbed from the ingested food. Dietary fiber may facilitate weight loss through reduced frequency of eating and food consumption. It's good for people with diabetes. For people with diabetes, eating a diet high in fiber slows glucose absorption from the small intestine into the blood. It delays the absorption of sugar in the blood. This reduces the possibility of a surge of insulin, the hormone produced by the pancreas, to stabilize blood glucose levels. It is found that diets low in fiber, especially insoluble types, may increase the risk of type 2 diabetes, Large cohort studies of women found that a diet low in fiber, especially lacking cereal fibers, but containing food with a high glycemic index, increased the risk of developing type 2 diabetes mellitus. Fiber for preventing heart disease. Strong predictor of heart disease and abnormal blood cholesterol, LDL, and HDL levels. It appears that soluble fiber reduces the absorption of cholesterol in your intestine by binding with bile and dietary cholesterol so that the body excretes it. The oat bran and bean fiber intervention trials, where dietary fiber supplementation was combined with low-fat diet, shows that reductions in total cholesterol levels range from 8 to 26%. Fiber for bowel disorders. Roughing up your diet can be the key to healthier bowels. With the introduction of white flour came an increased prevalence of bowel disorders such as diverticulosis, diverticulitis, hemorrhoids, polyps, colon cancer, and irritable bowel syndrome. In Burkitt's early research, some scientists report that fiber helps by decreasing transit time, increasing stool weight, and decreasing pressure within the colon. The same has been found for irritable bowel syndrome. The debate about diet and cancer. The debate about diet and cancer. Studies show a reduced risk of subcancers with a high fiber diet. These health benefits may occur indirectly through the protective effects of phytochemicals that are closely associated with the fiber components of fruits, vegetables, and cereal foods. It has also been suggested that dietary fiber dilutes harmful substances and possible carcinogens present in the diet, thus reducing the gut's exposure to such compounds. Fiber balances intestinal pH and stimulates intestinal fermentation production of short chain fatty acids. Fiber reduces depression and anxiety. Dietary fiber intake appears to associate with the risk for the development of depression. It has been hypothesized that inflammation may mediate the link between dietary fiber and depression, and that the association between a high fiber diet and a reduction in inflammatory compounds may alter the concentration of certain neurotransmitters that in turn would reduce the risk for the development of depression. Some helpful hints to add fiber in your diet. Increase slowly. The best way to begin a fiber-rich diet is to increase fiber intake gradually until you reach your recommended amount. Increasing too quickly can lead to gas, bloating, and diarrhea. Also, very high fiber diets are linked with decreased absorption of some important minerals such as iron, zinc, and calcium. Add the fluids. If you do not have enough fluids, preferably water with your high fiber diet, you may end up with constipation. Get into the habit of drinking a minimum of 2 liters of water every day. Little here, little there. You don't need to get all your fiber in one meal. Be creative and have sources of fiber throughout the day. Here are some ways to do this. Add flax seeds, nuts to your salad, soup, cereal, or yogurt. Have cut up veggies in small baggies available to take with you. Use them with a meal or as a snack. Use fruit with or in between your meals. Set a minimum number of servings to have each day and be sure to reach it. Always go for the fruit with skin or seeds for the fiber. Now coming to the food allergy and intolerance, some fiber containing foods need to be avoided in certain allergies. For example, wheat, rye, and barley have to be eliminated from the diet in celiac disease, which is thought to affect 1 in 300 to 1 in 100 people. Cereal peptides found in wheat, rye, and barley can trigger damage to the gut mucosa and consequently cause malabsorption of nutrients in susceptible individuals. To conclude the presentation, persons who consume a higher number of servings of whole food grains as a source of dietary fiber are at lower risk of developing coronary heart disease, diabetes, obesity, and certain gastrointestinal disorders. However, even though the benefits of dietary fiber consumption are documented, the consumption of dietary fiber is still below the recommended level. Thanks for watching.